Diagnosis: carcinoid. Chest radiograph. Metastases. Most likely site of an underlying primary tumor. Breast. No response to a course of antibiotics. Chest radiograph was normal. HRCT reveals mosaic perfusion with air trapping on expiratory scans, bronchial wall thickening, central-lobular ground glass and bronchiectasis. Diagnosis: B. bronchiolitis obliterans. Bronchoalveolar lavage samples grew Staphylococcus aureus and Pseudomonas aeruginosa. Diagnosis: cystic fibrosis. Which of the following descriptions on HRCT would increase the possibility of a Mycobacterium avium intracellulare, MI, versus Mycobacterium tuberculosis? Diffuse bronchiectasis and central-lobular nodulation. CT. A 2.5 cm lobulated mass in the right lower lobe with a heterogeneous appearance. A focus of low attenuation with the lesion had a density of -100 Hu. Most appropriate course of action? Advise no further investigations necessary. The most likely diagnosis is a pulmonary hamartoma. Chest radiograph. Pulmonary infiltrate in a reverse bat-wing distribution. What disease? Chronic eosinophilic pneumonia. Rheumatoid arthritis. What is the most frequent respiratory manifestation of the disease? A pleural effusion. Is increased transradiancy of the right lung. What additional feature would support a diagnosis of Swyer-James syndrome? Bronchiectasis. Expiratory wheeze. Chest.
Target 2 cm enterbronchial pulmonary mass and hence is visibility and late arterial diagnosis carcinoma. ठीक है, ऐसा आना चाहिए. फीमेल हिस्ट्री फीमेल एलवीडी फीमेल होगा और फिर मोस्ट लाइकली टू ब्रेस्ट कैंसर. ये मोस्टली ट्रेन पैट परफ्यूम में एयर ट्रैपिंग ये है डायग्नोसिस ब्रोंकियल एपिडेमिक निमोनिया नहीं है बिकॉज इट इज बैक्टीरिया. और ये जो इसमें कह रहा है कि नो रिस्पॉन्स टू एंटीबायोटिक्स, तो ये वायरल इन्फेक्शन है. तो ऑप्शन में निमोनिया गलत है. आंसर ये स्टाफिलोकोकस ऑरियस एंड ह्यूमरस एग्नोसिस सीनियर सिस्टिक फाइब्रोसिस. एमएसी में जो है डिफ्यूज ब्रोंकियल एंड नोडुलेशन होती है. ठीक है, डिफ्यूज. Just actually pulmonary reverse back distribution diagnosis in pulmonary pneumonia. तो ये जो है ये प्योर थिकनिंग राइट हेमाटोरैक्स तो डायग्नोसिस मेसेंटेलियोमा. ठीक है, इन केसिंग जब राइट हेमाटोरैक्स जो प्योर थिकनिंग तो ये मेसेंटेलियोमा है. Once I mean soft nodule in upper right shown. What will suggest malignant and spike rate appearance होता है. तो ये standard dental gradient from edge spike rate. So your female dermatitis and a bronchial self-treat, please I mean stop your impression. Lower maximum nodule, left hand 13 subcranial node. Subcranial जब आ जाए ना तो N2 बन जाता है. और इनको गिनो भी तो ये 2 नोड है. Pressure में legend. Program क्यों मना किया? पंदूर गला शाह है, पंदूर गला शाह है, पते गला शाह है. बस ये आंसर है.
Radiograph is normal. Diagnosis: asthma. History of breast carcinoma. Chest radiograph. Right upper lobe opacification adjacent to the mediastinum with a very well-defined lateral border and elevation of the right hilum. Most likely explanation: radiation pneumonitis. A painful rash on her shins, arthralgia. CXR. Bihilar lymphadenopathy. Diagnosis: sarcoidosis. HRCT. Small lung volumes. Areas of honeycombing and traction bronchiectasis and bronchiectasis. Diagnosis: Usual interstitial pneumonia, UIP. CT. 2 ill-defined foci of consolidation within the posterior and apical segments of the right upper lobe. Small, 4 mm, centrolobular, well-defined nodules within 1 cm of the pleural surface. These nodules were connected by linear, branching opacities. Most likely cause. Reactivation tuberculosis. Chest radiograph. A lobulated 3-M mass in the left lower zone with a small, rounded focus of calcification within it. Cord-like bands are seen extending from the mass to the left hilum. Diagnosis. Pulmonary arteriovenous malformation. Chest radiograph. Right-sided widening of the mediastinum in the region of the right hilum and calcification. Signs of right heart dilatation. CT. Focal, partly calcified right perihilar mediastinal mass, right heart dilatation and peripheral wedge-shaped areas of consolidation in the right lung. Diagnosis. Fibrosing mediastinitis. What further finding on HRCT would most favor a diagnosis of sarcoid over chronic extrinsic allergic alveolitis, EAA? Nodular thickening of the fissures. 52-year-old minor. Chest radiograph showed small, 10 mm, rounded mid and upper zone opacity, some of which displayed central calcification. Bilateral mediastinal adenopathy with peripheral eggshell calcification. Diagnosis. Silicosis. Admitted to ICU for support. CT demonstrated a short, concentric stenosis within the mid to distal trachea. Most likely explanation. Post-intubation stricture. And several blue/red raised skin lesions were noted. CD4 lymphocyte count is 120, normal greater than 500. HRCT. Diagnosis. Kaposi sarcoma. Homeless man. Auscultation blood analysis revealed neutrophilia. CT. Moderate upper zone centrolobular emphysema with consolidation within the posterior segments of both upper lobes and middle and right lower lobes. Diagnosis. Aspiration pneumonia. Allergic rhinitis and asthma. Renal impairment. Positive PANCA. Diagnosis. Churg-Strauss disease. Became markedly hypoxic 24 hours after bilateral lung transplantation. He had not been extubated due to increasing oxygen demands over the preceding hours, and his chest radiograph showed perihilar airspace opacification and bibasal pleural effusions. Diagnosis. Reperfusion syndrome. What would make another false femoral pseudoaneurysm more likely? D. Obesity. A 5 cm lesion immediately superficial to the proximal superficial femoral artery. On color duplex, this lesion demonstrated turbulent flow. Most appropriate treatment? Percutaneous thrombin injection. Minutes she had received a total of 12 mg of midazolam. Her respiratory rate was noted to be low and she became less responsive. What is the most appropriate flumazenol regime in this situation? 200 mg for bolus over 15 seconds followed by 100 mg at 1 minute intervals up to a maximum of 1000 mg. The decision was made to attempt bilateral renal artery stenting. What benefit over optimal medical therapy is this most likely to result in? Reduce episodes of pulmonary edema. With the aim of temporarily occluding the ovarian artery, what embolic agent is most appropriate? Gelfam. What would be an absolute contraindication to TIPS? Severe right-sided heart failure. What angiographic features would suggest that percutaneous transluminal angioplasty, PDA, would be beneficial? E-string of Beats appearance. In which of the following situations would you be happy to administer RTPA? E. The patient received streptokinase 10 years ago. What additional
First diagnosed history of pictures regular right upper lobe of calcification and adjacent to the mediastinum with very well-defined lateral border. तो ये well-defined lateral border elevation हर कारण पे जाते हैं radium नोड honeycomb से UIP ठीक है multiple nodule में पाते हैं ये reactive and या secondary tuberculosis और ये mass coral band like seen extended to the mass in left hilum और उसमें calcification भी होती है findings है permanent arterial conformation की ये 56-year-old airport smoking 50 cigarettes per day for 30 years जो है तो मुझे mixed obstructive respiratory problem with disease strong gas capacity we most likely diagnosed with respiratory bronchitis somebody else about airport ये आंसर है, नॉर्डियो तक नहीं होता फिगर नहीं मटा था नजर आता है, ये ऑप्शन गलत है। ठीक है, फिर मल्टीपल स्टैंड लाइक नोड्यूल्स भी इसलिए कोर्सेज जाते हैं, और ये भी है कि जो है स्मॉल लेस देन 10 mm नोड्यूल्स है एम्बेड इन अपर जोन सम विच हैव सेंट्रल कैविटी। ठीक है, और प्रिफर एक्सल क्लेपेरियन ये भी है तो 200 mg IV for 15 seconds for up to maximum of 4000. Valerian are standing help to reduce episode of pulmonary edema. ये डायग्नोसिस फार्मर्स को दिखाया तो इसकी ट्रीटमेंट है एंजियो पर क्लास टी ट्रीटमेंट है, तो इसमें आप